In Kenya, we are operating in coastal region, that is Kilifi and Mombasa County, and in western region, which is Homa Bay County and Kisumu County. In coastal region, we are doing HPV vaccination. We are doing cervical cancer, breast cancer awareness. At the same time, we are doing screening, and we are also supporting Kilifi County in building a chemotherapy treatment room, which will be actually the only treatment room in Kilifi County. Alone, we have gone out to schools and did vaccination to over 25,000 girls of 10 to 14 years. So, and this is a project that will continue for the next 4 years. Coastal region has been lagging behind with the girls getting HPV vaccination. So as a responsibility, we want to go to the communities, go to the schools, and get these girls vaccinated. Number two is we have 2 of these mobile trucks that will be equipped with equipment just to be able to treat those small minor lesions in the community out there. So we are going out there every day working with the Department of Health to do the screening in the community to create awareness to sensitize people. At the same time, when we do the screening for those small lesions, we treat for those ones, major ones, they will come back now to our specialists to look at them and look at them to the far end, to the palliative care aspect. We are not looking at just screening, treating, and leaving the patient. We are looking at screening, treating, and carrying all through the process. So out of the 20 women we screen out in the community, we get around 2, 3, 4 suspicious cases, which now we refer for further tests. Because suspicious doesn't mean somebody has cancer. But on the community for us is to check whether there is anything suspicious or abnormal, so then you can refer to the specialist to confirm through other methods that for sure this is a cancer or not.
We have about 5,800 new cases of cervical cancer that are diagnosed every year, and out of that we have about 3,800 women who die from cervical cancer. In terms of where cervical cancer ranks in terms of death, that's mortality, it is the leading cause of cancer-related death amongst women, overtaking even breast cancer, ovarian cancer, and all the other cancers. In the coast region, we are also seeing quite a high number of cervical cancer. In fact, if I see 10 patients in the clinic, 8 of them will have cervical cancer. In terms of data, we still are collecting lots and lots of data to find out exactly how the disease is affecting us. The one problem that we have in the region is misinformation. A lot of people think that because cervical cancer has been linked to HIV or because it's related to HPV, which is a sexually transmitted infection, it creates a lot of fear, a lot of stigma, so women do not come to the hospital. Another misconception is that if a woman is feeling well, she's feeling okay, why does she need to come to hospital just to be told she has cancer? What women don't understand is that cervical cancer, especially in the beginning, there'll be no signs and symptoms, and that's the time we have to screen women. And when it comes to precancerous changes, the ones that we screen for to detect, we can actually do it when a woman has absolutely no symptoms and prevent a woman from getting cervical cancer. Right now, most of the women that I see tend to have stage 3, stage 4 cancer, which they require chemoradiotherapy, which again can be very, very expensive. And we know right now with health insurance issues, some of them can't access the hospital. A woman coming all the way from South Coast, she might not be able to come to, say, CPGH to have the treatment given every single day for 5 weeks. So all these challenges, as well as financial toxicity, keep women from coming to hospital, unfortunately. Once women have been screened, you can see we have trucks over there. We're going into the community, raising awareness, screening women, and those who are discovered to have this disease, and they are assessed through the social network to see if they have the finances to be able to support the treatment. Those who are not able to, and we understand that a lot aren't, then there are means to actually support them through the care.
Some of the challenges that we encounter in the communities, one of them are the myths and conceptions that we have in the communities. And as a project, we are really trying to demystify these myths and conceptions towards meetings that we are doing at the county level. Remember, also working with the county. So the myths and conceptions that we have in the communities are one of the greatest hindrances. And also in some other communities, you'll find that in situations whereby we want to do HPV vaccinations, there is that resistance from parents. So we have to do a lot of information coming all through from the Ministry of Health, going back to the school health teachers. If there were no myths and conceptions and the hindrances in terms of the parents, trust me, by right now we could be talking about anything more than 25,000 when it comes to HPV vaccinations.